Our next speaker is someone who is literally changing the conversation about what good care is. What's more, he's doing that at scale inside the country's largest integrated delivery network, the Veterans Administration. He's having success changing the definition of high-quality care, and we're pleased that he's joined us here at Quality Talks. Please welcome Ben Kligler.
So, when you go to see your primary care doctor, what's the first thing he or she does? Pull up your problem list. And we all, I think, probably know what the problem list is, but in case you don't, the problem list is just that. List of every concern you've ever come to your healthcare team with over the years. So it might have your hypertension, insomnia, back pain, depression, diabetes, whatever it is over the years. Your physician feels that his or her job now is to work their way down the problem list and check off the box next to each problem. Every problem needs to have a treatment plan, a medication, a diagnostic test, a follow-up. And once he or she gets to the end of that list, their job is done. There's something wrong here. It's obvious to everybody here, I know. You are not just a collection of problems. You are a whole person, hopes, dreams, aspirations, problems, resources, challenges. And when we leave the whole person out, when we break you down into a list of problems or diseases or organ systems, we've lost the most important resource that's available to us, which is what you yourself can bring to the equation. I know this is obvious, but for whatever reason, we're still working in a healthcare system that hasn't figured out how to make it the focus. So what we're trying to do in the VA is move forward this idea of whole health. We're trying to change the conversation about what the role of the healthcare system really can be. And what we're doing with whole health is taking the idea that what matters to the person is really the primary focus, going past what's the matter with you, we like to say, and talking about what matters to you. And the idea is once we can get what matters to you as a person out in front of you and your healthcare team, the possibilities are endless, really, in terms of what you can do. And we like to talk about empowering and equipping the veteran to take charge of their life, take charge of their health, and move towards what matters. That's what we're after with whole health. And it's not just that this is a nice thing to do, we like the idea. There's compelling data about why we need to do this. When people are disconnected from their sense of purpose in life, when they don't feel like they know what matters, they have 2.4 times the risk of early mortality compared to people with high purpose. And this is not just about suicide and not just about depression. This is across the range of medical conditions, cardiovascular disease, for example. For whatever physiological reason, being connected to your purpose in life leads to longer life and better quality of life. So we're aiming to make this part of the conversation that the healthcare system has with its clients, its customers, its participants. And that's what we're doing with the whole health system. We're getting some really good traction in the VA, and I'll tell you a little bit more about that. This is Jennifer Yarborough. She's an Army veteran from an Army family. Her dad was a vet, her husband's a vet. When she was in the service, she developed some injuries and some chronic pain problems, like many veterans. She got home, also developed some anxiety about the transition to home, and then on top of everything, once she was home, got a new diagnosis of cancer. So Ms. Yarborough is stuck in her house, not going out, not doing what she wants, not connected with her purpose in life. Fortunately for her, her primary care doc at the Nashville VA connected her with a health coach. The job of a whole health coach isn't to address your problems. It's not a clinical relationship or a clinical encounter. It's to talk with you about what's important to you in your life right now, and then to work with you to make a plan for how to access the tools that you need to get there. So when we talk about purpose in life, we talk about expanding the aperture, so we're really looking at the whole person. And then when we talk about accessing the tools, we talk about expanding the toolbox to get to those destinations that we want to get to in our life. So for Ms. Yarborough, when she talked with her health coach, it turned out that the thing she wanted to be doing, what mattered to her right now, was riding her motorcycle. She had been an avid motorcyclist before, but now she just felt too weak, too anxious, didn't feel comfortable going out, didn't feel she could handle it. So the two of them made a plan. She developed a workout exercise plan that she could do first in her living room, got stronger, got out to the gym, got even stronger, started a yoga class for flexibility, and fairly soon thereafter, she was able to pull her motorcycle out and ride. So why is this important? It's not just about one person or one veteran and getting back on their motorcycle. Clearly, it's about the idea that your healthcare team can help you identify what matters to you and get there. So once she's done that and gotten on that motorcycle, what's next? The sky's the limit. Might be in her work, might be education, might be being with her family. 100 different ways she can decide what matters now and how am I going to get there. And that's what we're really after with Whole Health. So we do this using the whole health system. This is a healthcare delivery model for this whole health concept. We're getting a lot of traction across VA. In fiscal year 22, we had over 1 million veterans participate in one form or another in this whole health system. 3 crucial parts. The green bubble there is called the pathway. This is where a veteran can have a conversation with a health coach or with a fellow veteran who's been trained as a peer facilitator. That conversation focuses on what matters to you. Where do you want to go? What do you want to be the focus of what you're trying to get out of your healthcare? That can happen individually, can happen in a group, can happen on the phone, online, all kinds of ways. There's no wrong door to that. But now your sense of what matters to you is front and center and available for the rest of your team to understand. Then in the lower left, where it says equip, that's what we call the well-being program. This is where you go to start to get the tools, expand the toolbox, get the skills that you need. Maybe it's a nutrition class, exercise program, yoga, tai chi, meditation. VA covers a number of the complementary integrative health approaches now. So for example, that might also be where you go for an acupuncture referral to manage your pain better so that you need less pain medication. That's the well-being program. Then there's whole health clinical care, which is where we're still treating your problems. That's still obviously front and center in our responsibilities, but it's in the context of what's important to you. And it's with the knowledge on the part of your clinical team that to get motivated to take the steps you need to get motivated to take that antihypertensive that only 40% of you take, as we heard earlier, why are you doing it? You're doing it because it helps you move towards what matters. Now, you can imagine at this part of it, convincing 100,000 conventionally trained physicians, nurses, physical therapists that they want to shift a little bit from their find it, fix it mindset and from their entirely I am the expert mindset and you are the recipient of my expertise. This is a big lift, but fortunately a lot of them went into healthcare because they wanted to be with patients and understand people and talk to them about what was important to them. So we're making good progress. This is Reverend James Mitchell, another Army veteran. He developed some foot injuries in the service, also bad sciatic and back pain. Had a smoking issue when he went in the service. When he came out, it was a lot worse. And he was in a place where similarly, he was not getting what he wanted out of his life. He was stuck at home. He was actually using a walker because of the foot pain. His breathing status was bad because of the smoking. He just wasn't doing what he wanted to be doing in his life. So he got connected to a whole health coach at the Beckley VA. The first thing they talked about, what do you want to be doing in your life right now? And he said, I want to be getting out so that I can actually contribute something back to my community and do something. I want to do something. So for him, that meant smoking cessation class with a health coach supporting him. It meant getting referred to acupuncture because the pain medications that he was on were not satisfactory to him. He was having lots of side effects. He was very unhappy with what the pain medications were doing to his quality of life. So acupuncture and yoga referrals to help reduce some of the pain so he could take less medication. A year later, he's put the walker aside. He's out, he's working as a pastor in his community and advocating for fellow veterans to access the same kind of approach. Just another example, and I could tell you literally 100 stories like that from veterans who've really been able to get unstuck from where they were using this whole health approach. And what if he hadn't accessed that approach? Well, he'd still be home, separated from his purpose, so at risk for the early mortality we talked about, probably with respiratory and other problems ahead of him from the smoking, and really looking at lots of costs, lots of unsatisfactory engagements with the healthcare system. We've seen a huge amount of success in veterans who are using opioids on a chronic basis in being able to reduce their opioid dose when they engage with the whole health system. So this is a sample, 114,000 veterans. The left-hand bar, the black bar, is veterans who did not use whole health. Over the course of this year of observation, they dropped their average daily opioid dose by 11%. So not bad. You know, we're working on everybody getting onto a lower dose of opioids. Go to the right-hand side, those are veterans who engaged with 8 or more whole health visits. They dropped their dose by 38% over the course of this year. So we can't say this is necessarily cause and effect. This is an observational study, but that's a pretty large magnitude, 3.5 times the decrease in opioid utilization over the course of a year in veterans who chose to engage with whole health. We're also seeing veterans with chronic back pain who use whole health. When you look 18 months down the road from their first whole health visit, they have a 20% decrease in utilization of invasive spine procedures. So less epidurals, less back surgeries, less implantable stimulators. So not only potentially avoiding the pain and suffering of those procedures, but looking at some potential cost avoidance there as well. So just to swing back to why this is so important, connecting with what matters was what enabled both of those veterans to get out of the trap they were in, the trap caused by pain, by depression, anxiety, chronic medical illness, whatever it might be. And it set them on a road where they ultimately were potentially headed for better health outcomes. The Surgeon General came out with an amazing advisory this week on loneliness. Loneliness, the risk of chronic loneliness in terms of mortality equals the risk of 15 cigarettes a day. This is what was in the Surgeon General report. The risk of loss of purpose in life potentially is as great or even greater when you talk about 2.5 times the risk of dying. So what's the challenge? Why don't we do this? We just don't think about this as part of our job in healthcare. I take care of your diseases. I check off your problems, and that's what I do. What do you mean purpose? Why? What do you mean? And then not only that, but what if somebody tells me they have low purpose in life? What am I going to do? I don't know. How do I connect them with purpose? So we don't ask. But how can we feel good about not asking when we see the contribution that connecting with purpose can make to the kind of outcomes we're after? So there's another big challenge, and this is currently one of my big areas of obsession. How do we measure this? So, okay, as a healthcare system, we say we want to take on the well-being of the whole person. We're expanding the aperture. We're expanding the toolbox. This is great. How do we know if we're succeeding? So it turns out there are some validated measures. We're just not using them yet. There are validated measures of meaning and purpose in life, brief scales. We have a validated tool now called the well-being sign, a la Vital Signs, which asks the veteran to think about what's most important to you in your life right now, what role. Maybe it's your job, maybe it's taking care of your health, maybe it's your family. So what's most important to you right now? And then reflect over the last month, 0 to 10, are you satisfied, engaged, functioning well? And it gives you a numerical score. And so not only when we use this in clinical care does it start to change the conversation and it forces the conversation towards what matters to you, but then over time we can see whether this marker changes in response to one or another part of the whole health engagement. It's a validated scale and moves over time. The challenge, which we're working on, is getting a massive system to change workflows to actually incorporate this in routine clinical care. But we're going there. We're going to get there. It's slow, but we're making progress. So that idea of measurement, I think, is really a big part of where we need to go in thinking about this. I have one more veteran quote. I want to read it so I get it right. This is a 37-year-old woman in getting her care at the St. Louis VA. I used to drive over the Mississippi River Bridge to Jefferson Barracks VA, think about jumping every time. The whole health system has helped me explore my purpose, find ways to use nutrition to reduce my pain, and use iRest and Tai Chi to get moving again. Now I drive over that bridge and think about tomorrow, and I have hope. And so those 3 words, right? I have hope. That's really sums it up. What if that became part of our mission, part of our commitment in healthcare, is helping people reconnect with that? What would that do? What would that change about patients' experience? What would it change about our experience as healthcare givers? Imagine if that is explicitly part of our job. It's both scary and potentially very rewarding and exciting. So I would challenge you to take this idea home. This is not a hard idea to get behind. I think all of you, if you think about it, you think about, would you rather be connected to what matters to you in life and equipped to get there, or would you rather not be? It's pretty easy. So would you want that for your patients? Of course. So what are you going to do? If you're a clinician, maybe you want to put in these 2 questions into your daily visits. What's most important to you in your life right now? What's one thing you could do to start to move towards that? 2 quick questions. Maybe you could just try that out. If you run a clinic or a health system, maybe you want to think about starting routine measurement of well-being with a validated measure. You don't have to use the well-being sign. There's Cantrell's ladder. There's really quite a number of very quick, brief, validated measures of whole person well-being. Or if you're a payer, maybe you want to think about how this would enter into defining value-based care. What if value-based care included well-being? What if it included, did we really engage with what's most important to the person? That would be real value. So I hope you'll take that on. I hope you'll think about one of those challenges, and I know we'll all be the better for it as healthcare givers, and I know for sure our patients will be as well. So thank you.